how the person stands and what they look like. So just if I'm looking at James, his head's a little forward, his shoulders down here, this one's a little high, a little flare in his feet, a little dropped in his chest. That's what I'm seeing. That just kind of tells me that where he's going to start having tension. He's going to have tension up here because his head's forward. May have some lower back issues because he's not symmetrical down there. So, and just to do that. Then I'm going to check range of motion. I'm going to start with the cervical. I like to just place my hand on the person so they're not moving their body. Turn your head to your right for me as far as it goes. Great. Turn your head to your left as far as it goes. Any pain or discomfort?
No.
Tip over to the side as far as you go. Pain or discomfort?
No.
Go the other way. Pain or discomfort?
Nope.
He doesn't go as far to his left as he does to his right. I would jot that down. 30 degrees left, 40 degrees right. Tuck your chin to your chest. Pain or discomfort?
Nope.
Tip your head back as far as it goes. Pain or discomfort?
Nope.
Great. So I like to look at the skin when I'm doing the lower back because you get to see range of motion segmentally and where things angle off. Come back up. Lean back towards me. Good. Lean left. Lean right. So you probably start with camps. You know, cut it to that. So camps. The other side. Camps. Pain or discomfort. Then we're going to do belt test if we need to, bending over, and then we're going to do gelées. Finger on the S1, thumb on the S1 and the PSIS. And the left, the other one. This is also gives you information about Trendelenburg, right first, then left, yep, the other left, and then right, and then left. Looking for the thumb to drop. Okay? Do strength. Have them put their arms up. Push up against my hands. Bring your arms down. Push up against my hands. Push down against my hands. Bring your wrists up. Push up against my hands. Good. Open your fists. Grab my hands. Don't let me open. Good. Spread your fingers far as wide as you can. Good. Hold these fingers together. Hold these fingers together. Great. So that covers all of the muscle strength for the upper body. So cleared, done. If they're having a shoulder complaint, you could also add Jobs into it here, push up, and clear that out. So that's giving you that information. But for spinal stuff, nice straight through. A nice spinal screening, if they're having low back pain, stick this leg straight out. Seated straight leg raise, right? Put that one down, stick that one straight out. If they do this, stick that out. And they do this, they can't straighten it, then you know there's nerve root tension. So straight leg raise, anytime you hit 90-90, that's straight leg raise. So whether they're seated or laying down. I like to do it laying down as well because I get a different piece of information. But now we've covered all of that. Cervical compression. Make sure that they're sitting up straight. Push straight down on their head. Pain or discomfort?
No.
Lateral tilt. Push down. Any
Nope.
pain or discomfort? Same thing. Pain or discomfort. Turn. Pain or discomfort. Turn. Ask them pain or discomfort.
Nope.
Okay, now I'm going to have you turn, tilt, bring your head back in this position. Any pain or discomfort?
Nope.
Because remember, maximum cervical compression is not a compression test. Pain or discomfort with that.
No.
So that's like doing camps. You're shutting down the facets. If they have a cervical radiculopathy, they're going to get arm pain with that. But a lot of times you get facet referral from that. Shoulder depression. So you bring the head to the side, push down. That's tractioning the nerve root. Again, pain or discomfort. Always ask where the pain is if they have it. So a little tilt to the head, then push down on the shoulder to traction that. So you have your screening so that you could then go into your TOS test. Always make sure you get the pulse with them in neutral, because otherwise it's hard to get it especially if they have TOS things here. So you bring it back, then make sure it's still there. Then you can go through the variety of tests. Tip your head down, drop your shoulders down. Good. back up. So still have it, right? I've done that on one side. Come here, do rights. And I don't remember the names of everything. Relax your arm a little bit. Because I want to lift his arm, don't have him activated. But he loses his pulse here a little bit. So you're going to go slowly to check for pulse. You can come back down and see if it's coming back in. So he comes back in right here. So he's got a positive right on that. So you can do the same thing on the other side. You can, with TOS, you don't have to do every test. So I would say do rights and then do costoclavicular, because rather than doing one side, you're just doing both, and then you can see what's going on. So he's negative on his costoclavicular, but positive on rights. So decreased pulse amplitude, that's what he's getting. So we've covered all that. Pushed on his head, check TOS. I do the palpation while he's here. So I'm going to check his neck because he's already seated. He's got a little nasty spot right there. You go, is this tender? And they make faces. I feel it with my hand that he's making a face when I poke him there. So then I'm going to go down along his spine, kind of all the way down, just to see what I'm feeling. Then I'm going to come up, doing more motion palpation, using my knee to push, coming all the way up. See if I find areas that seem fairly stuck. He's a little tight right in here. So down into his lower lumbar, I could have, I guess, turned around. So then I might just go ahead and check turn for rotation while I'm here to lateral flexion. So doing my motion palpation, I can do that while he's right here. So I've done the screening, palpation screening, and found the tight areas, and then do a little more motion right then and there, because it's quicker that way, right? So let's say we go ahead and lie on your back. So I like to check leg length this way. Just check pelvis, see where he is here, see if there's a lot of pelvic rotation. Because I check pelvic rotation and leg length to see if there's anatomical leg length difference. And it's just how I do it rather than Deerfield's. So then I'm going to do straight leg raise. Make sure that you have your hand just above their knee. So as you come up, he has a little tightness. Where do you feel that? In his hamstring, right? If straight leg raise is negative, you do not have to do braggarts. Then here, put your foot here. Notice I went straight from straight leg raise to Faber's here to check this. You don't have to do Laguerre's if they don't have hip issues. So this is a nice screening. One of the things to pay attention on straight leg raising, he's like at 75 degrees there, 70, 75 degrees where his hamstring tension is. So we want to compare this side. This is better. He goes 90. Not making the face.
A little bit.
A little bit. When I go at 90 though, rather than 70 where he was. So that's more normal. It tells me asymmetry side to side. Put here. Any discomfort with that? Okay, so now we have straight leg raise. We have Faber's taken care of. Okay, so muscle strength, lower extremity. Bring your push out against my hand. So L4, hold your big toe up towards your face. L5, bring your foot up, hold it up there. S1, so push out. L4, hold your big toe up. L5, push your foot in. S1. So you have that. If you have your pinwheel, if you have a positive test like that, then you would do pinwheel. Or, just where you're going, it'll be challenging to do all of those kind of things unless you get some kind of symptom. There's not a good reason to go further into that dermatomal pain patterns and loss of sensation. If you have somebody that bad, then you'd have that translator with you right then and there to map out everything. But you can certainly do, soft touch on people just to make sure that they have that part of it. Again, once you find the abnormality, then you go after it and see what else is going on. Pull your knee up towards your chest. So I'm checking the psoas, come at 45, push up again, pull up here. Yeah. He likes to cheat. Go right there, pull up. Okay. So if this is normal, his Thomas will probably be normal. Pull up towards your face. Good. Push up again. So a little different way of checking the psoas. He's a little weak on that one. But for the sake of everything, sit on the end. A little bit more. Okay. Grab one knee and lean all the way back. Let the other leg fall. You got to make sure they don't have tight pants on because you're looking for the leg to go down. And look, his Thomas test is negative. So do the other leg. So I already checked that his muscle was firing correctly, which means that his psoas probably isn't short. But that, well, tighten your quads, relax. Pain with this?
Nope.
Pain with this?
Nope.
Notice I don't change sides of the table. Pain with this, pain with this, pain with this, because I don't want to waste my time doing that. For Yeomans, so that was hips and Eli's and Knocklas, right? So Yeomans, you find the sacrum, you block it. So so here, sacrum, block the sacrum, lift up, pain or discomfort. He doesn't have any restriction there. So usually they'll say ow right when you push.